the origin insertion has in it spindle cells which need to be reset or recalibrated so that muscle can regain its postural tone again. This can be done by actually approximating the origin insertions of a muscle and pressing in one direction or another, depending if they've gone hypertonic or hypertonic. Another quality is that the fascia of the muscle can become strained, and we need to strip across the muscle like this. And the way you can test if this needs doing is if we did a directional stretch like that and pressed a previously intact muscle and it tested weak, that would show that there was a facial distortion on that muscle and it would need to be recalibrated. And sometimes we need to ring muscles. So if we looked at, say, a quadratus lumborum, it might need to be wrung in different directions on its fascia depending on how the strain patterns affected the fascia of that muscle. So that's another treatment option that we would look at. Another option is to recalibrate, and this is very important on this postural set muscle to do with sacroiliac problems, is to what we call pandiculate, which is almost like yawning. Most animals have to pandiculate their muscles after they've been in the sleeping position because they can't recalibrate without this essential quality. Human beings, however, don't have to, but if we can pandiculate those muscles, which is to compress and transmit a stretch, almost like a yawn through the muscle, so we're stretching the origin insertion distally, then that helps to recalibrate the muscle and recalibrate it to its postural set. So it's a very important technique. All of these muscles supersede the kind of massage that you would normally need to do, and pressure on any muscle helps the water constitution. As a muscle goes into contraction, it pumps water out and pumps calcium in, which helps to stiffen the muscle and give it its stability and strength while it's in that state of phasic contraction. Sometimes when the muscle has been strained, the Golgi cells override the spindle cells as a protective measure, and they lock the muscle into a locked state, and that keeps the water in a hydrated position, which is not good for the muscle. It then becomes fibrous, it becomes inflammatory and congested with toxins. So again, we need to recalibrate those muscles, and heavy pressure starts, this is the Anma phase, heavy pressure on a muscle can recalibrate this tissue constitution and water constitution in the muscle. So that's basically how our Anma procedures work, working down the spine, feeling for nodules and fibrous points in the muscles and working them out.